that was trying to lean on us today?
I don't want to like separate it or whatever, but I'll sit by you.
I would.
Stare deeply.
That's completely.
I'll let you complete that for you. Yeah. Traditional 1 minute.
Yeah, that's right.
All right, so we have taken our traditional 4:01 start time here. As usual, it's my pleasure to introduce our Grand Round speaker. So our speaker today, Dr. Zuzanna Stuart, who is well known to everyone in the room, and I would expect everyone online as well. Dr. Stuart is really a Chicagoland native of sorts, and then completed her medical school training in her ancestral Poland before completing internal medicine residency at Mercy Health in Rockford. Before we were lucky enough to recruit her. She is now a second-year fellow. We are excited for you to have some time off soon and then rejoin us so that you can complete your endocrine fellowship. We're excited to hear about endocrine disrupting chemicals today, so I will not take any further time. Zuzanna, it's all you.
Thank you very much, Dr. Carroll. Good evening or good afternoon. I guess it's 4 p.m. and beautiful outside. Don't even know what the proper, I guess, a term to address this hour would be. But thank you all for being here. Once again, as Dr. Carroll mentioned, I'm Zuzanna Stuart. I think I know almost everyone here except maybe one or two faces, and I am one of the incoming PGY 5 fellows as of the last 2 weeks. The topic endocrine disrupting chemicals is mainly a product of my curiosity for a subject I knew very little about, and there might have been some mild influence from some subliminal messaging from the Endo Society. And the goal of this lecture is not necessarily to provide lots of dry, boring details about a lot of different biochemicals, but more so to provide a brief overview of the subject. So moving forward, I have no financial disclosures. By 5 p.m., the goal is to identify a few common endocrine disrupting chemicals, recognize mechanisms of disruption, so there's a little bit of a basic biochem review, describe a couple adverse outcomes, and then, as mentioned, I will try to make this a little less sciencey and give you some historical context and some commentary as to where public policy is today. So what is an endocrine disrupting chemical? It's an exogenous chemical or mixture of chemicals that can interfere with any aspect of hormone action. And hormone action can be further defined as a relationship between secreted chemical messengers and their target, the receptors. These interactions between the chemicals and the receptors lead to regulation of vast set of functions: growth, development, reproduction, metabolism, weight regulation, you name it. And simply speaking, interference of this complex communication system can lead to adverse health outcomes. These chemicals have natural and synthetic sources and are commonly encountered as pesticides, biocides, plastic polymers, food contact materials. Exposures occur through encounters at work, consumer products, medications, natural resources, participating in the military. Given that there's more than 350,000 chemicals on the market, with thousands of new chemicals being produced every day, we have upwards of 1,000 or more chemicals labeled as endocrine disrupting chemicals. The likelihood of exposure to these things is just ever so increasing. A little bit of background. So despite the first time the phrase endocrine disrupting chemical being coined in 1991, the notion that environmental chemicals interfere with hormones stems for over 70 years ago. In the early 1920s, pig farmers somewhere in the US were concerned about a lack of fertility in swine fed with moldy grain. Later, this was attributed to mycoestrogen, so fungus that have some chemical that resembled estrogen and led to gonadotroph inhibition. In 1962, Rachel Carlson published a book, Silent Spring, that really brought to light all the consequences of DDT and made all of the, I guess, notions, concerns public. And in the most recent time, Dr. Theo Colburn, from, I guess you could call her not necessarily a Wisconsin native, but a connection to Wisconsin, more so brought up the connection between the environment and humans to light. Her research, publications, and advocacy really propelled the effect of endocrine disrupting chemicals on wildlife and humans into the public sphere. She was a former pharmacist that moved here to Wisconsin. She actually obtained her PhD as an environmental analyst at the age of 58 at UW-Madison. Her first project in 1988 focused on Great Lakes pollution, the effects of endocrine disrupting chemicals, or I guess at that point, chemicals on fish, aquatic birds, wildlife. And initially the theory was that perhaps these contaminants or pollutants were going to be more carcinogenic, but she discovered that there were more reproductive and developmental problems in wildlife. Because of this, she also participated, I should probably say she was one of the 21 individuals that formed the World Wildlife Fund wing spread conference that happened in Racine, Wisconsin in 1991, and this is where this term was coined. Afterwards, she published a book, Our Soul and Future, 1996. I can't really say that I've read it, but it did, in the same way, the book Silent Spring of Rachel Carson, the same way it propelled knowledge of the effects of DDT, this book did also raise awareness about the detrimental effects of EDCs on human and wildlife. Now, since then, multiple organizations across the globe have attempted to set policies and increase awareness of the harms of EDCs. In 1996, the Food Quality Protection Act was passed as a screening program. In 1999, the EU issued a community statement for endocrine disruption with recommended actions. In 2012, the United Nations Environment Program and the WHO proposed a revised assessment and did label EDCs as a global threat. Now, where are we as endocrinologists? So in 2009, 18 years after the wing spread meeting, the Endocrine Society published its first scientific statement outlining the mechanisms and effects of endocrine disruptors. This was later revised in 2015 to include the overall burden of disease and expand it past just endocrine and comment on neurodevelopmental changes, reproductive changes, metabolic changes, and cancers. It also offered commentary on nonlinear and non-monotonic dose responses. Because I think when it comes to common toxicology, the idea is that there's a proportion of effect related to the dose. Well, despite it not necessarily being kind of intuitive, there have been studies that have proven that low doses of a chemical actually exert more harm, and at higher doses, those same effects aren't there. What it also did comment on at that revised statement was that the effect of a particular chemical was also dependent on the time of exposure or the life cycle or critical development period. And since 2015, the Endocrine Society has continued to make updates as to their statements and raise awareness. In 2017, they issued a policy or a position statement to try to improve utilization and increase further policies. And then the most recent one, which I'll comment on towards the end of the presentation, I think in 2014, they also tried their best to make this a more recognized concern in the eyes of politicians. Now, why do we care? Unfortunately, endocrine disrupting chemicals as a whole are related to common non-communicable diseases, even at what we call relevant doses or very, very low doses, doses that are less than what current agencies list as being acceptable. Given variability in the environment, they have the potential to contribute as drivers to potential healthcare disparities on the basis of race, ethnicity, income. Advances in science, the ever-growing causal relationship between endocrine disrupting hormones and the adverse events, as well as growing public interests, is propelling this into policy. And then, of course, when it comes to the associated costs of healthcare, if you take an annual healthcare cost, lost earnings, that can even be attributed to low doses, low daily exposure Currently, it's exceeding $340 billion. Now, taking a step back and kind of focusing on the chemicals at hand, what are the mechanisms of interference? Simply put, they can affect at any point of the hormone regulation, whether that's synthesis of the hormones, transport, metabolism, or site of the actual action. They can activate hormone receptors, they can antagonize them, they can affect hormone receptor expression themselves, they can alter signal transduction, RNA expression, post-translational modifications, epigenetic modifications, hormone synthesis overall. They can affect transport of different chemicals across membranes. They can affect the distribution of circulating hormones, metabolism, clearance, and of course, the overall responsiveness of our hormones themselves. Common receptors that we focus on, estrogen, androgen, thyroid. We're all very familiar with those aspects of endocrinology. The other receptors that can be affected are the peroxisome proliferator activator receptor gamma, estrogen-related receptors, and glucocorticoid receptors. And then sometimes the other ones are the ones that are more so across membranes, FSH and nicotinic acetylcholine receptors. Now going into a little bit of the nitty-gritty science of things. So atrazine is a common herbicide usually used for corn, sorghum, sugarcane. It ends up being present in runoffs. It's not really easily absorbed into soil. Therefore, it's present in various environments, whether that's soil, surface water, groundwater. It has a pretty low safety limit, and we encounter it in the form of drinking water, well contamination. I think there's actually one paper that I read where there's a bunch of wells that are affected in Iowa. Now, with respect to animal models, we do know that pregnant rats, when they were administered or came in contact with atrazine at various concentrations, it led to overall shorter gestational ages, increased mortality, decreased body weight, and delayed vaginal opening. With respect to the kind of axis that we're normally concerned about, it does present itself as a neuroendocrine disruptor, specifically affecting the hypothalamic pituitary axis. It affects kisspeptin signaling, and what ends up happening is it suppresses peaks and surges with LH, FSH. From a purely downstream signaling pathway, it affects cyclic AMP by actually inhibiting the phosphodiesterase, thereby leading to higher concentrations. It upregulates aromatase inhibitors. It participates in the methylation process, and then unfortunately also does affect dopamine synthesis, can lead to reduced dopamine concentrations. Moving on, BPA, I feel like this is one of the more popularized ones. It was initially synthesized in 1981, but considered as a synthetic estrogen in the 1930s. It's ubiquitous. Exposure commonly comes in the form of water, raw plant materials, thermal paper, so receipt paper, things like that. And usually used in the manufacturing process of polycarbonate plastics and epoxy resins. And we encounter it also as a byproduct of manufacturing, food packing, toys, lining of canned foods, beverages. It has estrogen-like and anti-androgen-like properties, and we can ingest it either through the digestive tract, the respiratory tract, or even skin absorption. From a mechanistic perspective, there's a very wide variety of mechanisms that have been studied, and there's also some discrepancies, or I should probably say some variability in what has been found, but we do know that it affects adipogenesis. It inhibits adiponectin secretion, leading to more insulin resistance. From the gonadotroph kind of perspective, it alters the way GnRH gets released via peptin. It can competitively bind with glucocorticoid receptors, and then it can directly affect the pituitary to disrupt TSH release. Simply put, you can have multi-system toxicity, which in the form of, I guess, treatment or clinical scenarios, we would deal with decreased sperm quality, PCOS, POI, and effects with neurodevelopment. Now, So perchlorate, it's a colorless salt, often found in rockets, explosive fireworks. And the way we also run into this is through groundwater accumulation. So for all these individuals that celebrated 4th of July, maybe we need to tone down on the fireworks outside of protecting our pets. It's a contaminant of bleach, and it has been detected in crops, infant formula, cow's milk. From a endocrine perspective, it seems like the greatest amount of research has actually gone into how it affects the thyroid. It's a potent competitive inhibitor of the sodium iodine symporter. So therefore, it reduces iodine intake into the thyroid, inhibiting hormone synthesis. And fun fact, I guess historically it has been used to treat hyperthyroidism, although I haven't actually seen details as to dosing and whatnot. That being said, the most vulnerable populations are pregnant individuals, lactating women, and then developing infants. And the ATA has actually issued a statement or guideline encouraging that any person contemplating pregnancy to at least have 150 micrograms of iodine supplementation for specifically at that dose, so that if you do get exposed to this, which chances are we are, that we would overwhelm it or bypass the dose at which it would block iodine absorption. Now, PFAS, or polyfluoroalkyl substances, very large group of chemicals, upwards of 10 to 15,000 chemicals, often used in firefighting foam, nonstick pans, paper textile coatings. All of these products show up in the home, food storage industries, personal care products. Problem with these is that they do resist degradation due to their structure, and they're usually divided up into short chains, long chains, or legacy PFAS. And unfortunately, we have proof that even the long chain PFAS that were detected or that were present and banned many, many years ago have been detected in young individuals born after that ban has been in place. To grant the title of this name, you need at least one fluorinated methyl or methylene carbon atom, and the mechanisms are very mixed. Sometimes some of the literature based on in vitro studies suggests that you have an increase in T4. Sometimes you have an increase in T4 glucuronidation, suggesting that there's increased elimination of this, and in some cases suggested that it does affect that sodium iodine symporter. The effects of it are also, unfortunately, mixed. There's mention that these can cause precocious puberty, but at the same time also delay puberty. Some of these differences are postulated to be related more so to the individual differences between these 10,000 chemicals, where there's different side chains, groups, and in order to actually get a sense of what is happening, you have to focus on the individual chemical itself to know what you're looking at and what effect it might have. There's a paper that was published in 2015 that actually commented that oddly enough, despite this being something that resists degradation, women that were breastfeeding ended up having lower concentrations because it transferred with the breast milk to the children. And down the line, when they analyzed breast development, the individuals that were formula fed and breast milk fed, those unfortunately did have higher levels of PFAS than individuals that just received infant formulas, and there was an inverse relationship when it comes to breast development and the duration of breastfeeding. Now, phthalates, colorless, viscous, liquid plasticizers. Technically, these are esters of 1,2-benzene dicarboxylic acid, very commonly found in food packing, cosmetics, and unfortunately in something that we also deal with here quite frequently, IV tubing. Fun fact, if you look at any plastic and you look at the actual recycling symbol, if there's a 3V or PVC, and we know that's in there. Outside of products, we do come in contact with phthalates in soil, drinking water, dust even, so it can be aerosolized. It does lead to androgen production disruption, specifically at the level of the Leydig and Sertoli cells, so testicular dysgenesis syndrome. And then similarly, it can have anti-estrogenic effects and lead to antral follicle development inhibition. It does have a much higher affinity to sex hormone binding globulin, so it probably knocks off what we would call important endogenous hormones that we have. And then unfortunately, it can also interfere with insulin receptor, leading to insulin resistance and whatnot. Taking us all into kind of consideration, and I know that at some point that's going to sound very redundant, but it does affect fertility, low semen quality, motility. In young gentlemen, it can affect the anogenital distance. And then, of course, there's always neurodevelopmental risks that come with this. But once again, because it's a big class of medications, there's lots of conflicting results as to how it affects different tissues, and it's all dose dependent and chemical side chain dependent. Now, phytoestrogens are actually naturally occurring compounds, polyphenolic molecules, very similar to estrogen. The most common ones that we all often probably deal with are legumes, soybeans, and whatnot, but these are also present in beer, so keep that in mind. So isoflavonoids, what happens is they do bind to the beta estrogen receptor. They also bind to DHT. They induce sex hormone binding globulin synthesis and inhibit aromatase. At the end of the day, there's a lot of ambiguity as to whether these are problematic or not, and there's lots of variabilities in studies. There's some suggestions out there that for patients that do take over-the-counter preparations that are soy-based for purposes of vasomotor symptoms, menopause, and whatnot, that they do have some benefit, specifically lower risk of osteoporosis, better or less risk of cardiovascular disease, cardiometabolic disease, and whatnot. But at the end of the day, not enough studies have been elicited to completely rule these in as being problematic or not. They also do, unfortunately, affect serotonergic pathways, the insulin growth pathways, cyclic AMP, DNA methylation, and anything that goes alongside that. Okay. Now, moving on, the polychlorinated biphenyls. It's a class of greater than 200 chemicals, formerly used in insulation. They were initially created in 1929 and finally banned in 1979. And the reason why they were kind of brought into the public sphere is because in 1968, there was greater than 1,000 individuals poisoned in Japan by the consumption of contaminated rice oil from a heat exchanger liquid. And at that point in time, they noticed that there was some effect on thyroid synthesis, and patients unfortunately also had additional adverse events, persistent growth restriction, movement disorders, and substantial differences in IQ. So after that unfortunate event, these were brought into the public eye as persistent organic pollutants, and the unfortunate thing is that their half-life is greater than a decade, and some of them a couple decades. So that being said, PCBs, can affect thyroid function. Usually it's in the form of increased glucuronidation at the level of the liver. So degradation of T4. You can also have displacement of T4 by its effect linked to transthyretin. And then it can actually inhibit the binding of T3 with the TR receptor and kind of ineffectively or effectively dissociate the complexes downstream and antagonize that receptor. However, as with the theme of the last couple chemicals, depending on the study, sometimes contact with these chemicals has been deemed to not have an effect. And then the last chemical that I'll comment on is triclosan. This is an antimicrobial, very, very common in actual personal care products, so things like deodorant, toothpaste. We come in contact with it in the form of ingestion, dermal or mucosal contact. It's usually a white, odorless, crystalline powder, and it binds to estrogen receptors, decreases GnRH, antral follicles. In terms of reproductive health, it does inhibit placental 11-beta HSD2 enzyme, which then ends up leading to a decrease in the viability of syncytial trophoblasts, leading to an increased risk of abortion. Now, when it comes to effect of thyroid hormone production, the results are mixed. The mechanism is unconfirmed, and using the NHAES population, it seemed like it had a positive relationship in the sense that the overall concentration increased, and in a different study from, I guess, a similar time frame, the home study, unfortunately, there was an inverse relationship. So at the end of the day, despite these chemicals being things that are being widely studied, unfortunately, there's so many variables at play where it's difficult to actually pinpoint what effect is happening, what population's being affected, and downstream, which mechanism is at play. And to just briefly summarize a few of the systems that we kind of focused on. So overall thyroid function affected by PBCs, BPA, dioxins, triclosan, soy flavonoids, phthalates. Mechanisms are very vast. Iodine uptake can be affected. Overall hormone production itself related to that. Interconversion between T4, T3, cell receptor activations, and then of course degradation, specifically at the level of the liver with glucuronidation. And then soy or isoflavonoids are also TPO inhibitors. From the reproductive aspect of things, the clinical things that we may come in contact with: precocious puberty, delayed puberty, PCOS, POI, sperm anomalies leading to infertility, hypospadias, ectopic testes. And these mechanisms are quite vast. You can have upregulation of GnRH or suppression. You can have direct stimulation or issues at the level of the ovary or testicles. You can have inhibition of enzymes that degrade some of these endogenous hormones. And overall, you can have a decrease in the weight of the actual gonad. And then, of course, effect of transcription factors down the line. So why is this field so complicated, and why don't we have an answer as to what is happening? Well, for starters, these chemicals unfortunately can't follow common principles of evaluation with respect to toxicology. The dose responses are not monotonic, so there's differences when it comes to the dose at different tissues and length of exposure. Low dose may not necessarily be better than high dose in terms of adverse outcomes. The other thing is we're not exposed to just one of these things. We're exposed to multiple chemicals at once. So these mixtures of EDCs all coming from a common source, whether that's runoff, water, rain, or whatnot, can be quite complex and synergistic. So when you have too many variables at play, can you really point out what is causing the actual problem? From a research perspective, in order to establish causality, you need to have longitudinal epidemiologic studies, and these are very difficult to arrange, to attribute and, I guess, limit or account for the variables. And of course, there's always the aspect of money, especially when a lot of these chemicals are byproducts of the manufacturing business. And then from a pure testing receptor perspective, it's not like we're measuring one substance. All of these chemicals that I mentioned are mainly classes of chemicals. So in order to be effective at knowing and identifying the problem, you need to know exactly what you're testing. And from a toxicologic assay perspective, you need to know the specific tissue and the receptor. And it's just not easy to create one test to pick up on everything. In the world of regulation, the Organization for Economic Cooperation and Development also brought to light that problems with regulation now are that they are mainly focused on the common endocrinologic conditions that we deal with on a daily basis, so reproductive, a little bit of metabolic, thyroid, but they don't really focus on any of the other endocrine pathologies. They don't try to expand the research beyond thyroid and reproductive system. So where are we now? The Endocrine Society just recently in April released another position statement, and some of these statements seem like they are redundant in the sense that they're bringing the same issue to light. But the truth of the matter is that we haven't, despite emerging research, we haven't made much progress when it comes to limiting these chemicals, or at least investing in trying to get them out of our environments. So in April 2025, and I quote, mentioned that they're concerned that human health is at risk because current extensive scientific knowledge on EDCs and their health effects is not effectively translated to regulatory policies that fully protect populations from EDC exposure. Just 3 days ago, the Endocrine Society, along with the European Society for Pediatric Endocrinology and the European Society of Endocrinology, released an open letter. And I don't know if currently there's some political changes happening or if there's a lot of voting, but they just 3 days ago published a letter that is a attempt at a cry for help to make policy changes for the same issue. Now, as to what organizations are involved, since that initial conference in 1991, there's been many organizations that are trying to bring this issue to light. The Endocrine Society, the task force that started in 2008 and published their first statement in 2009, the European Chemical Agency, the United Nations Environment Program, and the WHO, as well as the FDA, EPA, and the REACH organization in Europe, all have made statements and continue to make statements to try to bring awareness to these chemicals, emerging research, and need for more policy to try to prevent these adverse events from happening in the future. So if you ever want to, if anyone is interested and wants to do a little bit more research, a lot of these organizations themselves do cater their language to the general public, but they provide links to NIH, to a program called Tox 21, where you can actually look up more details, as well as see if there's any research that you can contribute to. But this is a good place to start, and I hope that in all due time, with increasing awareness, that we have more resources geared towards having a strong foundation as to how to recognize these chemicals and start to try to combat them and get rid of them in the environment. Thank you very much.
We will put up questions, and if anybody virtually wants to unmute or chat, go ahead. I guess I'll start by just, I don't know, so much of a question as a comment. I mean, I think there's wide agreement that many of these, especially kind of the top offenders, you know, BPA and a few, are clearly detrimental. Yet there's very little push from our regulatory agencies to do much about it. Clearly, this is a challenging time in the U.S. for things like that. I know that there was just a report about endocrine disrupting chemicals. I think it was from Scandinavia, like literally maybe yesterday. Mm-hmm. So, I mean, do you think that we're actually making any headway here, or?
Looking at all of the statements, I know, so initially, the one that was published, I think in 2009, gave a very nice scientific overview as what they are, and why we need to act on it. But I do feel like the subsequent statements have kind of just been repeating the same thing. So in 2017, it's a cry for help, like, please do something policy-wise to try to make changes. And this last one, I think in 2015 in April, almost sounds like the same thing. Like, yes, we know that there's some extensive research. Yes, we have gaps. And yes, we know that there's health effects, but I don't think that much has been done to try to limit these. I did read, I think there's one paper that commented on how expensive it is to actually come up with some kind of strategy for water filtration. And I think that number was maybe upwards of 200 million. And I guess the question with now, with our current government would be, where would that money come from? Is it from taxes? And how do we approach this, given that all of these chemicals are quite ubiquitous? This has to be a global effort. And I don't know how much other countries outside of the US and a couple of these countries from the EU, how involved they are. So I feel like this issue has been highlighted over the last 10 years, and we haven't gotten much progress yet.
So when our patients ask about the endocrine disruptive chemicals, what is the general advice that you would tell them how to at least minimize exposure?
I would say that the unfortunate thing is that most of us have already been exposed to some extent. And moving forward, one step would be encouraging them to actually pursue advocacy and talk to politicians and try to propagate change from that end of things. And then, of course, knowing how some of these chemicals are distributor found, to avoid certain plastics or read labels and try to stay on top of avoiding some of these manufacturers. I mean, we can't really go back in time and remove some of the plastic that was part of electrical systems 30, 40, 50 years ago. But moving forward, knowing that future chemicals are also not well established, I think giving them also a sense of skepticism of read and kind of advocate and look at labels is probably a good place to start. And I would say, don't tell them to necessarily, I guess, breastfeed extensively thinking that they're going to get rid of the chemical from their body and transmit it to their child. I don't advise that. But I think knowing that these things are an issue and being skeptical of manufacturing companies and not necessarily just going with the flow would help in the future.
Are there any other European countries who have tried to eliminate? Sometimes it's easier in smaller countries, and has that been done? And because a lot of European organizations are saying that what kind of things that they have implemented.
I'm not familiar with any country implementing a specific, let's say, strategy for water filtration or whatnot, but I do know that certain countries have been more investing more in finding out why. I think there was a study maybe in the late 90s, early 2000s, where specifically I think they were looking at, maybe it was actually Belgium even, that their fertility rates were much lower than other countries, and they invested money into figuring out which chemicals are involved. So in that respect, I feel like there's differences with allocation of resources for investigation research, but I don't know much about any strategies that they may have implemented to try to remove these chemicals.
I mean, they're trying to make you pay for plastic bags. You can never, ever get any, and they're kind of getting more and more expensive. So like, even if you go to the supermarket and whatever, there are no plastic bags. You can't get it. I mean, that's one of the little things that I guess that it's far cry.
Kind of along those same lines, is there any data looking at maybe where you might have less exposure to some of these chemicals in certain countries around the world compared to, like, I mean, Europe and America, like, we're exposed to these chemicals obviously ubiquitously, it's everywhere. I was just wondering if there was anything like looking at maybe countries where they don't have that much lower exposure to some of these chemicals.
Are you trying to find a new place to move to, Dr. Voss? I have to say, I'm not familiar with the geographical distribution of these chemicals because I think it's so much more so individual based. You'd have to tell me which chemical you're concerned about, and then I have to do the research. But I do know that there's geographical variability here, even within this country, which then does unfortunately contribute to healthcare disparities. And kind of, I guess, in a similar way, lead can be considered, I guess, an endocrine disrupting chemical to some extent. And depending on socioeconomic status or geography, there's still neighborhoods based off of old construction sites that you would have increased rates of exposure to things like that. So I'm sure there is variability, but if you wanted details and a map, or if you wanted me to talk about all these chemicals, we'd be here for days and looking at different colors.
You came across any particular one that, maybe had a lower exposure rate, if there was any differences?
Oddly enough, I did actually come across one paper that commented that I think PFAS or that one of the phthalates was actually higher concentration in Poland for some reason. But I did not look into the actual reason behind it, whether it's manufacturing, exposure, or whatnot.
Did you come across anything about microplastics? Did they cover
Macroplastics? Microplastics, excuse me. Unfortunately, I did not go into that direction with my literature search.
Piggybacking off that, I don't want to make this controversial, but what about red dye?
Oh.
It's a hot topic. People are going to ask. I'm not trying to be controversial. I'm just curious because that is a comment that's obviously in the news and is in politics and is out there. So I haven't. Has anybody been asked that? I haven't been. I was just thinking about it.
I was trying to avoid controversy. But all jokes aside, there's so many chemicals out there that I had to kind of pick and choose the things that were most common within a certain, I guess, realm of things. So I did not look into red dye, but I can get back to you, Dr. Foss.
I'm just curious because that's obviously a hot button. So
I think it's more cancers.
I think so too. I don't have any idea. So just curious.
Other questions? Before everybody goes, I'll just remind you, you should have gotten an email about the evaluations for the Grand Round series. Please fill those out because they monitor that. If we don't get enough responses, we get yelled at. And I'm big on not getting yelled at. So please fill those out. We appreciate it. Thank you very much.
So you could say if you don't fill the evaluation, you don't get the speaking credits.
I could. That's not true.
That is, yeah, that's what we do for all the conference.
Okay.